always say, bring your calculator. Let's figure out the cost.
Yeah.
So that's what we are trying to do, is educate people. So once you turn 65, you can make, the best decision and informed decision, but you have to understand how Medicare works. Medicaid is a federal agency that oversees Medicare, and as I said, it falls under Health and Human Services, so it's IRS, Social Security, and Medicare, so we're all linked together. What I tell people is when you get a lot of mail, just flip the brochure or whatever. If it says CMS, it's official from Medicare. Everything else is advertising. And just like the IRS and Social Security, they're not going to call you or email you. If it's official, they'll send you a letter. So you don't have to take the phone calls, and just know everything else is advertising if it doesn't have CMS.
The next one? Yeah.
Okay, so this is where I was talking about Medicare has 4 parts. The Part A and B, that comes from the federal government, and where we help, Esther, Barry, and I, we help you with the private insurance part. If you just have Part A and B from the government, that covers 80% of your costs, excuse me, and then you're exposed to 20% with no cap. So where we help you is with the private insurance, the Part C, also known as Medicare Advantage, the Part D, the prescription drug plan, and although it's not a part, we also help you with the Medicare supplement part. So what we do is give you comprehensive coverage. Do the next slide.
Yes.
So this is from the Medicare New Book, and I like to see things visually. And this is a good representation of comprehensive coverage with Medicare. There's only 2 options. You can do original Medicare or Medicare Advantage. The original Medicare is a Part A and B from the federal government. Then you add on the prescription drug plan, and then you add the supplemental coverage. That is one route for comprehensive coverage. The other route is Medicare Advantage, also known as Part C, and again, it has a Part A and B from the government, and then bundled together, it has the prescription drug plan and other extra benefits. These are the only 2 routes that you could have for Medicare for comprehensive coverage. And Esther and Barry will go over the supplements and Medicare Advantage and Part D.
What should we know about projected Part B premium increase in 2026?
So I think they're saying about 205 or 206, right? Yeah, we don't know exactly, but it's about 205 or 206.
From 180?
Yes, okay. 185.
185,
yes.
Okay.
So they determined that sometime in November, the government will let us know what it'll be for the following year. And the surcharge, depending on your income. I also want to address penalties under Medicare. Any penalties under Medicare is for the rest of your life. So I'm just going to briefly go over this. You can get on Medicare, there's only 2 ways you could get on Medicare. One is when you turn 65, you could get Medicare. The other route is if you're on Social Security disability for 24 months. Those are the only 2 ways you could get on Medicare. So say that, as I said, there's only 2 routes for comprehensive coverage, and say you turn 65 in June. For Medicare Advantage, you have 3 months before your birthday month, and 3 months after to sign up for Medicare. If you do a supplement, you have 6 months, June through November, to sign up. If you miss these periods, you're gonna get a late enrollment penalty. So you have a time frame to sign up for Medicare. That is if you're retired and you're 65. But let's say that you decide to work. If you have work insurance, you can still keep taking your work insurance. Medicare is if you do not have insurance. If you don't have your work insurance, you have to take Medicare. So another scenario is, say you start in September instead of June because you're working till September. So then it just pushes back the time. You have September to February, 7 months, tied to the Part B start. And then the Medigap, you have 6 months. And the reason why the Medigap, the supplement, is important is when you first go on Medicare, it's the only time you could get on Medicare supplement with guaranteed issue, where they're not gonna ask you, you don't have to go through underwriting. So pre-existing conditions matter in Medicare. So if you have chronic conditions and you don't go on Medicare supplement, when you first go on Medicare, you're probably not going to pass underwriting, and you're probably not going to be able to get it in the future. Okay? So there are penalties if you don't sign up within those time frames. Okay? And any penalties in Medicare are for the rest of it. Barry and Esther, they'll talk a little bit more about Medicare Supplement and Medicare Advantage, but I want to talk about two big changes in Medicare coming in 2026. One is in the Endeavor network. Aetna Medicare is leaving the Endeavor network. So if you have Aetna and your doctors are in Endeavor, you're going to have to change your insurance plan. Endeavor is only going to take Essence, United Healthcare, Blue Cross Blue Shield, and Humana. The other is the DSNP is coming to the Chicago or Illinois market. And the DSNP is a dual special needs plan for people who are on Medicare and full Medicaid. So that's the current insurance MMAI program ends, and then the dual eligible special needs starts January 1st. And there's going to be 4 carriers. It's going to be Humana, Molina, Meridian, and Aetna. And those are the 4 insurance companies that the DSNPs that offer the DSNPs. And these plans are so much better than what is currently available for them. First, they have more integration and care coordination for mental health, medication, and medical. And it's just a better plan, better network, better benefits. So anyone who's on Medicaid, full Medicaid, they should really go on the DSNP. There's transportation. It's just a much better plan for them, and that's available in 2026. Okay, I'm done with my part, and then.
Can I ask a question?
Yes, of course.
This is important. Another concept here is IRMA, right? IRMAA, the income-related monthly adjustment amount.
Yes.
Can you explain a little more about that?
We just had talked about it. So your Part B has IRMA. That's the $185 that you pay the government every month. And as a individual, I think it's about like 115. Is that right?
106.
What?
106.
Okay, 106. Oh, you have that.
I do.
Okay, it's 106, and then as a married couple, what was that?
212.
Okay, 212. So they're looking at your adjusted gross income of 2 years back, and if you've made more than that, you're gonna have to pay a surcharge. And the surcharge, there's a sliding scale, so the more you make, the higher the surcharge. And you also have a surcharge for the prescription drug Part D.
Mm-hmm.
That's also, so B and D have surcharges, okay?
Some plans, Advantage plans, some of them, and prescription plans, they have premiums. LIS will lower those premiums for those folks. So even if they're kind of close, floating around those thresholds, we advise them to try to apply, and we can help them do that.
We're gonna move on to Part D,
Okay.
drug plans, right?
Yeah,
The
yeah, yeah.
prescription drug. The Inflation Reduction Act has brought huge change to Part D. Can you break down the most impactful updates to Medicare Part D for 2026?
Yeah, so that Reduction Act, 2025 is the first year that we've implemented it. So in 2024, the most that a person would pay for their prescription drugs, catastrophic level was $8,000. So if you had expensive meds, you'd have to go through something that was called the donut hole. They did away with that. And you may not actually pay that full $8,000, but if the calculations come together, $8,000 was your top end. 2025, they lowered that to $2,000. So big improvement for people on expensive meds, but that $8,000 down to $2,000, that $6,000 exposure was then transferred to the carriers. So they had to make a lot of adjustments and some predictions with what they didn't know. So a lot of them played a little bit of defense. They made adjustments that maybe over exaggerated what to expect. So 2026 is going to still be a ripple effect of adjustments. So some of those things that they did, the Advantage plans, in some cases reduced benefits like less dental, less vision. Some of them took away transportation, raising copays, raising max out of pocket. So they made their adjustments, and now this year they've kind of lived through how well they calculated and predicted, and then there's going to be 2026 as that calculation continues. So $2,000 was 2025. 2026 will be 2,100. So slight increase. Other things that they did to absorb that change. The max deductible for prescriptions in 2025 was $590. 26, it's going to go up to $615. A lot of Advantage plans and some standalone prescription plans, they didn't maximize that deductible. Like some would have no deductible, some would level that at $250. And even those that do have deductibles, they might only assign that to the more higher tier meds. So your tier 1 or your generic may not be susceptible to deductible. But tier 3 is your Ozempic, your Jardiance. Those higher expenses, in the beginning, you're going to have to pay full price until satisfying your deductible. So what that did was create upfront cost exposure for a lot of people with more expensive meds. So if you had a tier 3, 4, or 5, in the first months of filling that prescription, you're paying full price until you satisfy that $590. Then you're progressing your way towards that max out of pocket of $2,000. And we saw a lot of people hit that $2,000 threshold in March. So just a few months worth of the plan, and excuse me, so it created a lot of upfront costs that we had to navigate. So some people were better off in other plans with better formularies. So it's important every year that people kind of evaluate where they are and learn about the changes coming, because they might be in a perfect spot right now, and it might not be a good fit for 2026. I could keep going, but there might have been more you wanted to talk. Okay.
Let's do a deep dive on this one.
Mm-hmm.
So can you also explain the new Medicare prescription payment plan?
Sure, yeah. So that upfront cost, it was kind of a known entity. Like a lot of these people are going to hit their max in the first 3 months. So along with those changes, Medicare required all of the carriers to implement a payment program, kind of an installment sort of thing. So you're no longer paying at the pharmacy when you pick up your meds. If you have Humana, Aetna, whoever it is, you can divide that $2,000 over 12 months. So I did the math, it's something like $166 a month. So if you're looking at maxing out in the first couple months, it makes sense to do the payment program, and then you're not paying at the pharmacy, you're paying Humana, Aetna, whoever you have. And that'll be the same when it's 2,100. I didn't do the math on that part, but for those who are going to hit that threshold early in the year, even in the first 6 months, it makes sense to consider spreading that out.
What about the people with a limited income?
Mm-hmm. So let me just say that these prescription details that I'm talking about, the deductible at $590, the going up to $615, those parameters and progressions are exactly the same, whether that's embedded in an Advantage plan or whether it's a standalone prescription plan. So if you go Advantage, it's embedded, but it's the same progressions and thresholds. And then if you do a supplemental, we also highly recommend, you don't have to, but then you're exposed to late enrollment penalties if you do not also get a standalone prescription plan. But the same progressions there. Now some folks, it's called LIS, Low Income Subsidy. There's a lot of people eligible that don't even know. So we can talk to them about, I can throw some numbers at you. Individually, somebody of an income, and this is current numbers, they fluctuate, but right now, an individual at $22,600, let's say, and even if they're close, we recommend they apply by calling up Social Security and applying for LIS, also called Extra Help. There's also a resources component, so not just your income, but how much do you have in the bank, bonds, savings. So that threshold for an individual is a little over 17,000. So if you're under those numbers, 22,000 income, 17,000 assets, you as an individual can qualify. Married couples, that income is a little over 30,000 and assets pretty much doubling right around 34,000. If you're qualified for LIS, then it sets a limit to the copays you're going to pay for your prescriptions. It only applies to prescription costs. Like the Medicaid stuff that Grace mentioned, that's going to help in many areas. Like the copays that you may pay, Medicaid's going to handle that. LIS is only specific to prescriptions, and an expensive med that you might have a $45 copay, it might only be $4.35. Higher end, something that's, let's say like some of the more expensive meds, you have to pay 25-50% of the retail cost. LIS can cap that at around $11. So it's a big help. And also, if you're on LIS, that late enrollment penalty for prescriptions goes away. There's nothing that takes away the late enrollment penalty for Part B. But if somebody has a late enrollment for prescriptions, LIS absolves them of that. Some plans, Advantage plans, some of them, and prescription plans, they have premiums. LIS will lower those premiums for those folks. So even if they're kind of close, floating around those thresholds, we advise them to try to apply, and we can help them do that. You help them navigate the Social Security site, and so we do a lot of advocating for our clients. We help them navigate this process, help them zero in on the right fit, and each year absorb these changes.
Whenever I sit down in front of somebody, you want to look at both sides. You want to make sure that you're considering what is your budget. And I did put together a get ready for 2026 list, and one of the check marks here is you got to make sure that you look at your budget.
And now, Esther, since we are moving on to this plan choices, the choices between a Medicare Advantage plan and the Medigap plan can be confusing.
Yeah.
Can you clearly explain the core difference between these two paths for 2026?
Sure. So not only for 2026, but just in general, the clear difference is network, right? So, and that's one of them. And the second one is going to be on the supplement side, the copays are a lot less. You just worry about the Part B copay on Plan G, which is the most comprehensive, but you don't worry about any of the other copays. On the Medicare Advantage side, you pay a lot less every month, but you have copays. And a lot of times that can be cost prohibitive for an individual who has limited resources. And so I don't like it when people say, oh, it's cheaper. It's not necessarily cheaper if you get serviced that year where you have surgery, then you need therapy, then you need multiple doctor's visits. These out-of-pocket costs are adding up really fast. And so I always sit down in front of somebody, you want to look at both sides. You want to make sure that you're considering what is your budget. And I did put together a get ready for 2026 list. And one of the check marks here is you got to make sure that if I end up having a bad year where I have to get therapy and I have to go to multiple doctor visits, I have to see a specialist, can I afford that? That's the question that the person on the other side of the table needs to ask. The plus side of the supplement is that, yes, you're paying a higher premium. They do go up every month, but the flexibility of care is there. So if you want to go in-state, out-of-state, as long as they take your Medicare plan, 99% of the time, they do take your supplement plan. I've been doing this for 10 years, and there's only one time where I heard that someone was not willing to work with a specific carrier. So I always still check to make sure that the doctors are willing to work with the supplement because of my own experience, but that's one of the bigger differences between the two is the network and how the costs are allocated. Keep in mind that yes, the supplement does go up every year, but if you compare the maximum out of pocket on a Medicare Advantage plan to the cost of the supplement, you will see that potentially the first couple years you're still saving by paying a higher out of pocket every month on the supplement.
Well, so this is very interesting. I mean, so let's go a little deeper here. How can someone in the community ensure that their current network, doctors and hospital and their network, into a new plans of network?
Right, great question. So before we could confidently say this is the network and we're looking at it in 2025 for 2026, what happened last year is a lot of last minute changes came at the very end of the year. That was difficult for us as agents, and it was also difficult for the beneficiaries that were signing up. So it's always important when you sit down with someone, you got to check your doctors, you got to check your parents' doctors, your aunt's doctors, whoever it is that you're helping, and you got to check your medications. Just because your doctors are in network doesn't always make it the right plan if your medications aren't covered or they're in higher tiers. Which those change every year, and so you got to make sure you're looking at that. A couple things on the things that both Barry and Grace did share, which I thought they did a really nice job breaking things down. One question I get a lot is, as Grace shared, you have the 3 months before, the month of your birthday, and the 3 months after. Sometimes people think they're beating the system by signing up on that first month. You still have to wait till you're 65. And I always get a kick out of that because I'm like, no, you're not 65 yet. Technically, you don't even have Part A or B. It doesn't start until that day. So just keep that in mind. Yeah. If you turn 65 and you're not ready to retire and you're contributing to an HSA plan, do not sign up for Part A. You get Part A automatically. People get really scared because their coworkers tell them you didn't sign up, you're going to get a late enrollment penalty. Talk to someone like Barry, Grace, or myself because you do not have to sign up. You can take your time. When you're ready to retire, then you'll go ahead and sign up. Or if you don't have an HSA and you want to sign up for your Part A, fine. It's not going to impact you one way or the other. With the sign up of the Medicare Advantage plan, I know Grace talked about the timeline. You only have 63 days to sign up for a Part D though. So if you decide not to take action and put everything on hold, in order for you to have prescription drug coverage, just know that you only have 63 days to sign up for that, which really is 60 days because they don't give you the full 63 days.
So, when I started doing these seminars, and this will be my 3rd year, and every year you learn more about Medicare. And what I found is, people don't understand their own insurance. So part of my presentation is vocabulary. They don't know what a deductible is. There's so many people that I help that tell me that they don't pay for their insurance because they never look at their paycheck and see that they do actually pay for insurance. So when I do my seminars, I really want people to come before they turn 65 because I think Medicare has done a great job where people associate Medicare and 65. But besides that, they're confused about everything else. But they know something about 65. So I tell people, come to the seminar because we, as a society, we're not taught to shop insurance. Whatever company that you work for, they've already decided on what group policy that they want. So then your choices are HMO or PPO. But once you're 65, whether you're working or not, you can take or keep your work insurance, but you should compare it to Medicare. And you could still work and take Medicare too. And for example, my husband works for a huge international architecture and engineering firm, international, and we pay $8,000 deductible. And I could tell you, if I was 65, I would go on Medicare and not keep his insurance. Because that deductible, you're paying, if something happens to you, you pay that deductible. Most Medicare plans have really low deductible or zero. You're going straight into the plan, and for Medicare Advantage, a lot of those plans are $0. So, you know what Esther was saying, my calculator, like, let's figure out the cost.
Yeah.
So that's what we are trying to do, is educate people, so when you turn 65, you can make, you know, the best decision and informed decision, but you have to understand how Medicare works.
Compare if you're still working, turning 65, we generally say the vast majority are better going off to Medicare. The exceptions would be some of the stuff we talked about, IRMA. If you're a high earner and your Part B is gonna be, I mean, these higher levels can be
$600.
Yep, $628 for your Part B, and then the added
Surcharge, but that's a surcharge.
and then your added costs for Part D is $85 on top of that. So if you're a high earner, it might make sense to stay with your work plan. The costs might be better. Another example or thing to consider is expensive medications. A lot of people have their medications covered better through the work plan than if they were stepping into a $2,000 exposure with Medicare. But the majority, I think, are better off financially going to Medicare when they're eligible.
Thank you. Yeah, I get a lot of questions about that. Like, and I still am working, and which one is better?
And as Grace said, that $8,000 deductible, that's a huge component.
Yeah, that's adding to your cost.
And you're not just paying a premium, you have upfront $8,000 before the plan's gonna help.
Yeah. Can I ask, so there's popular plans like plan, I think you mentioned about a Plan G. So what are the key differences between the most popular plans like the Plan G and Plan N?
Do you want the?
I mean,
Yeah, go ahead, Barry. Go ahead.
so Plan G and Plan N are very similar, except for Plan G has your Part B deductible. Currently this year, Part B deductible is $257. So you pay your premium, your first couple doctor's visits are gonna be full price till you satisfy $257. Plan N is a similar structure. You still have that deductible, and that deductible is gonna go up next year too. Everything keeps going up. I believe it's gonna be
28.
Yep, there it is, yep. So Plan N has a few components that are different. It's less expensive, that's great, but the G, once your deductible satisfied, there's no more costs other than your premium. And you're gonna have some copays, ER visits, some doctor's visits. They're not huge, but there are some copays, $50 here and there. One of the big components that I talk about or caution people about is Plan G, and like you ran into somebody that didn't take that plan, it is contingent upon that doctor accepting Medicare assignment, as they call it. With the Plan N, if they are not happy with that Medicare assignment, which is Medicare has a list of all the different treatments and they have a set amount that they are willing to pay. The doctor must accept that assignment. Plan N allows them to say, I don't like that amount, I'm gonna add 15% to that payment, and that 15% is then billed to that Plan N beneficiary. So I've never actually seen anybody do it. You have, but it is a definite exposure of an added 15%, and the Plan N is $30, $40, $50 less per, and I don't know that it's a...
It's not, I don't find it that huge.
It's not a big difference, so Plan G is generally where we begin that conversation. If somebody insists on Plan N, I'm gonna caution them and talk about it, but we'll give them what they want. But Plan G is pretty much the preferred go-to.
I just wanted to add, with supplements, what I found, why people like supplements is, you could budget, right? You know what the monthly premium is going to be, and you know that you have to pay your Part B deductible, but you could budget in a year about how much you're gonna spend for medical needs. And I think that people sort of like knowing this is how much I'm gonna spend. It's the unknown that sort of freak people out, right? Like, I don't know how much that MRI is gonna cost me. I don't know how much this hospital stay is gonna cost me. So I find that most people, that's why they want this Plan G. They know exactly how much they're paying every month. They know what they're exposed to, the Part B deductible, and basically they don't have to look at their hospital bill.
Their bill, it's just gonna come up as Part B access. And so he was saying that he has not experienced someone getting those charges. I have seen someone get those charges. It doesn't say, hey, we're billing you an extra 15% because our contract, blah, blah, blah. It says, your ER visit was $600, Medicare paid, $300, your plan covered $100, you're gonna be charged for $200. It's basically how they break it down. And so people don't like Plan N when they walk out of the hospital, is really when they see the difference between the two plans. That's when it really hurts them. And so I always try to caution people, like Grace said, bring your calculator, let's look at different scenarios and see which one would be the least impactful. I think Plan N people a lot of times think, I'm never gonna go to the hospital. I'm gonna be fine, that's not gonna, and that is exactly what the conversation was with this person that I signed up for Plan N. And so I just said, well, you went to the hospital, you said you weren't gonna go. That was part of our conversation. So you have fun with it, but as Maureen said at the beginning, I don't know who was here, seniors know everything.
Annual enrollment period is coming
Yes.
very soon, yes? It's
Yeah.
October 7th?
Well,
15. October 15.
15 through December 7th,
Right.
so you were close.
And it's always those dates,
Right.
always.
October 15. So can each of us, and each of you, share one of a must-do tip? Those, every person in this room should follow before AEP ends on December 7th.
Look at your plan. Everyone should look at your plan. If you're on a PDP plan, a prescription drug plan, look at the formularies, look at the co-pays, make sure you know what you're gonna be paying in 2026 and that all your medications are there. If you're on a Medicare Advantage plan, you still wanna look at all your medications. Like Barry mentioned earlier, they kind of follow the same format as an individual prescription drug plan, but you also need to check your doctors and the hospitals that are in the plan. And then your supplement. Your supplement, if you need to switch and you're in good health, shop it. We anticipate that they're gonna be going up 20 to 30% in 2026. A lot of delayed care due to COVID has really hit the carriers in the last year, and so they're seeing a lot of people that should have gotten care within that time frame, they didn't, and then they continued not to, so now you're seeing chronic situations come up from lack of care, and so that's adding to the cost of care. So
I just want to add, I think you have to be flexible and adaptable. I think the Medicare Advantage plans are really 1 calendar year plans. So you could change them every year. And you yourself, your health care or your health, you could have a new doctor, one of your doctors retired, you could be on a new medication. So I think that you should look at it, and us as agents, we review your plan every year with you. So you should take advantage of that and just be flexible. I had someone call and said, I need dentures next year. So I really want a plan with a very strong dental. So just be flexible. Just because your plan worked for you 5 years ago, it doesn't mean it's the best plan for you now.
just have them talk to us. Every year, these things change, and we're, like you mentioned, Aetna leaving, the networks change, doctors retire. Every year, it's worth another look. And hey, the easiest thing is to tell you you're in the right spot. I wouldn't change a thing, and that's nice and smooth. But 2025 had more shakeup with that reduction act, and a lot of people had to change because their prescription formulary was more, it's gonna hurt them more in the plan they were in, even though they loved it. So just review it every year.
This is really good.
I just wanted to add, last year, someone called me, she was not my client, December 8th, and she said, I didn't know that my Silver Script prescription drug plan went from $20 to $50. She said, what should I do? And I said, do you need these medications? Because if you get off the prescription drug plan, you're now gonna have penalties, right, for the rest of your life. And I said, I'm sorry, but this is like a hard lesson learned. I'm sure next year you're gonna read your announcement of changes. You know, you have to read the announcement of changes and see how it affects your plan.
Okay, yes, Glenn.
I want to go back to LIS. Does it only apply to recipients who are over the age of 65, or do people who qualify because of a disability, can LIS apply to them?
Somebody qualifying for Medicare after 2 years of disability is also eligible for LIS.
Program for beneficiaries. So if the person is a beneficiary regardless of the age, they qualify to apply for the program.
Okay. That's helpful.
It's risk tolerance, educating the client on how these things work together, but everybody has their own preference, and we just try to help them navigate that.
One other thing I did want to add on the DSNPs is you do have to be FBDE qualified. So just because you're on Medicaid doesn't mean you can go on a DSNP plan. You have to be full benefit
100%.
Medicaid. Yeah.
Medicaid is a whole another. I wanna highlight that the next hour have a legal planning, advanced directives, and end of life planning that is scheduled in November 20th. That's a Thursday at Belmont Village. It's evening, and that's a 1 week before Thanksgiving.
Nice.
And we really, want to have this conversation, get informed, and then so we can have a more deeper conversation with the family members. Because we know the tendency of, difficult conversation, we tend to, delay until crisis comes in. And we do not want that. This is why we created this education program.
Yes.
But thank you so much, everyone, for joining, and thank you, panelists.
Yes, thank
Appreciate
you.
it so much.
Thank you, Sunny, for having us.
Thank you.
Always nice to serve
Round of
everyone.
applause, please. Thank you.